Welcome back to New York Links. This week we tagged along with the Caribbean American Outreach Association's trip to Hopeville Community Center in Clarendon, Jamaica. Keisha Allen continues the mission. First, the organization visited a basic school that received medical help the previous year.
We're here at Pond Top Basic School. This is a basic school that the Caribbean American Outreach Association provided health services last year. So we just made a quick stop and they're here chit-chatting with the kids and the teachers here.
Hello.
Dr. Mallet, what kind of services did you guys provide here last year?
Okay, we were here approximately almost exactly a year ago, and we provided audiology testing, in other words, hearing testing for the children, in addition to general pediatric examination.
Ms. Hill, she is the principal here at Pond Top Basic School. Can you tell us what kind of services were provided last year to the kids?
I was not present. I was at a seminar in Ocheros last year, but Mr. Dyer or Mrs. Hamilton, who are two teachers at the school, will be able to tell you better.
The children were given vaccination. They had hearing tests, and they were given medication. Some of them, if the medication were not available, a prescription was written for them so that it could be.
And what does it mean to you to have this organization come here and provide these services for these kids?
It's wonderful, you know. It's really good because some parents might not be able to afford the necessary medication, and when these people came along and they assisted us, that was really good, and I appreciated it, and I'm sure the parents do appreciate it also.
Okay, thank you. We're here in Hopeville Community Center in Clarendon, which is another location stop for the Caribbean American Outreach Association, and they'll be here providing assistance to people here within this community who are in need of medical assistance.
The community center was the brainchild of the late Pat Morrison, whose sisters are carrying on her work and spoke emotionally of her and her wishes.
My sister in 2004 or 5 came back to Jamaica to help in the medical for the people in this vicinity, because medical care was kind of not very much here, and so she made this little clinic center from our own retirement money. She made this center that she would be able to help the people, to teach them health care, to teach them diabetic care and whatever. She got ill in December, or she dedicated the center this October. And the December after she became ill, she came down with cancer of the colon. She went back to the United States and she died last year, May. The center was closed up. We haven't been able to do anything with it. But Jean, my husband's cousin, told us about the group she has that comes down to Jamaica each year to do some medical service. So I asked her, please, if she could do just one day here in remembrance of my sister, because I know if she knew what was going on and if she would appreciate this so much that the people in the community would get some medical care. Okay.
So this is your first time hosting this kind of event. So do you plan on keeping this tradition going?
We would love to, yeah. We want to do that in honor of her, because I know she would have appreciated this, and she wanted to do this. We were hoping that we would do this while she was alive each year, like.
Okay, so what does it mean for you, for this organization to be here today to provide the services to the people of this community?
It's kind of hard to explain. It's fulfilling, of course. There are about 6 or more medical people in our family, and one of the things that my sisters had asked them to do is to carry on her work somehow. Unfortunately, they were not able to join up with this trip, but in the future we are hoping and planning that they will form a group and will be here to help us with this activity, this event, or something similar to this.
The doctors, nurses, and dentists administered medical service as we have seen from their visits to other parts of the island.
What type of medication you think you might be using today?
Mostly hypertensive medications. There's a lot of those. Skin rashes, mostly a lot of dermatology stuff, because we see a lot of those cases, and some diabetic medications. So we have a lot of those medications and a lot of pain, Tylenol, aspirin, Motrin, Advil, because we see a lot of aches and pains, the elderly and those who carries a lot of weight on the head and stuff, and then a lot of pain in the ankles and feet because of course the road condition and the walking. So we have a lot of aches and pains.
Dr. Wilson, who is a dentist in Jamaica, is closely tied to this mission.
Well, I'm a family member of this organization. Actually, I'm right from this little home that you see right here. I was born and grown up right in this place.
Okay, what kind of services are you going to be providing here today?
Dental services. Actually, I'm going to be doing dental examinations, writing prescriptions, and making referrals to the clinic and to private dentists. For those who can't afford to pay, then of course I'll send them to the dental clinic.
Can you tell me, how was it today for you to see the doctor? How did you find the experience?
Well, I could say that the experience was good, and I must say that the doctors, they know to interact with patients, yes, with patients. It was good. Overall, it was good.
Okay, for you?
It was good. I enjoyed the day. It's good.
Okay, so what do you think about the organization coming here to provide health care? Do you think it's a good thing? It's an okay thing? What do you think?
It's a good thing.
Well, I believe that it's a good thing, yes, because sometimes even though we heard that going to the hospital is free now, many people will not go because probably there's a lot of people there. Coming into the community, you'll have more people coming from their district to be here. You get a first hand with the doctor and nurses. You're able to explain to them exactly what is going on without seeing somebody's behind you or to say that time is running out. Yes, I think it's very, very good.
Jean Hamilton explains how individuals and organizations can help support the Caribbean American Outreach Association.
Can you tell us, Jean, how does the Caribbean American Outreach Association go about getting the medical supplies that is necessary, that is needed for this health mission?
We get donation from MAP International, and we also buy some ourselves, and we get donation from different doctors.
Okay, so how do you go about choosing the locations for these missions?
Well, people ask us to come to different places. That's, the need is great, so we follow that pattern.
Okay, in regards to the question I asked before about how do you go about the supplies, if someone is watching now and they wanted to, donate medication, or money, when do you have fundraisers, or how do they go about doing that?
Well, they can visit our website at caoa.org, inc.org, sorry. Or they can call 917-770-7983, to get one of us, and we can tell them where to send the donation or the medication.
Say a nurse or a doctor is watching and they want to lend their support. How do they go about that? Do they go about that the same way as?
The same way. They can call us, and we get them to fill out an application, and they could, come with us on our missions.
Okay, thank you so much, Jean. And we are wrapping here at the Hopeville Community Center, where the Caribbean American Outreach Association have been providing healthcare services to people here in the Clarendon community. Now, these people have received various medical attention today. They've seen the medical doctor as well as the dentist. We've seen close to 100 people, so it was a fairly good turnout. This is Keisha Allen with Zinc TV New York Links.
We're back after this break.